Welcome to our latest edition of Board in Brief. I'm Patrick Vernon, the Chair of Birmingham and Solihull Integrated Care Board. And in this edition of Board in Brief, I'll be showing updates on the Midland Metropolitan University Hospital, our mental health provider collaborative, our community care collaborative, the GP provider support unit, and the general election. At our board, we agreed our system-wide engagement and support for the opening of the Midlands Metropolitan University Hospital. We are working with colleagues in the Black Country who are leading with Sandwell and West Birmingham NHS Trust to plan for the opening and any impact on how patients can access both in our system as well as in the Black Country system too. This hospital has the potential to be one of the most transformative investments in health and social care in Birmingham and the Black Country since the opening of the Queen Elizabeth Hospital over 20 years ago. Our system is fully committed to the safe and successful opening of the Midland Metropolitan Hospital, and we are ambitious for the transformation impact that this new hospital will have in delivering improved care to all our communities in West Birmingham and beyond. With regards to the Mental Health Provider Collaborative, we had Patrick Numba, who is the Executive Director of Strategy, People and Partnerships, as well as the Deputy Chief Exec of Birmingham and Solihull Mental Health Foundation Trust. He shared the updates with the board around the progress of the Mental Health Provider Collaborative. We heard some examples of how the collaborative is improving patients' experience. For example, in reducing out-area placements, repatriating patients back to a setting closer to their home, and doing so to ensure that service users have the ability to connect with friends and families in their local communities. The collaborative has taken the opportunity to reset and build a better relationship with our voluntary sector organisation. The team are now developing a strategy for mental health in Birmingham and Solihull, which will include engagement with our communities. We also had the opportunity to hear from Birmingham Community Healthcare Chief Executive Richard Kirby, who presented the implementation plan for the Community Care Collaborative. The vision for Birmingham and Solihull Integrated Care System is that people of Birmingham and Solihull will live longer, healthier and happier lives. In order to achieve this vision, an important priority is the integration in local places of health and care services to better meet the needs of individuals and local communities, and to tackle the long-standing inequalities in health and care provision in terms of access, experience and outcome. The Birmingham and Solihull Community Care Collaborative will deliver more holistic, integrated care at place, at locality and neighbourhood level. The implementation plan, which Richard shared, builds on the strategic outline business case, which we approved as a board in November last year, describing the models of care, including the role of localities and the priorities of 5 work programme areas: integrated teams in neighbourhoods and localities, intermediate care, long-term conditions, supporting primary care development, and children's community services. The plan sets out the role that the collaborative will take across the portfolio of services, and that in the financial year 25-26, the collaborative will be the lead provider for the following services: adult community services, localities and neighbourhood teams, NHS intermediate care services, and the GP provider support unit. The board endorsed the plan and warmly welcomed the ambitions of the Community Care Collaborative, which we are fully committed to make sure that this will improve at a local and place level the health well-being of our local populations. We heard the case for change, for the transfer of our GP provider support unit and its resources to Birmingham Community Healthcare. This is linked to the development of the Community Care Collaborative, which I've just touched on. The GP provider support unit was established by us as ICB back in November 2022, separating the commissioning and provider roles for primary care. Its role is to support general practice, to improve and address sustainability concerns, increase standardisation of care, and delivery and support practices to deliver improvements in access. It aligns with our Inception framework and enabling primary care strategy, and will see staff working closer to the patients and practices they serve. The board agreed the case for change, and subject to further work in progress, the GP provider support unit will transfer to the Community Trust in the fourth quarter of this year, 24-25, with budgets being transferred from the 1st of April 2025. We just had the general election, and we have written as an ICB to the MPs who have come back again to serve 5 more years, as well as writing to the new MPs that's been elected, as well as writing and communicating to those MPs who've stepped down. We want to work closely with our elected representatives to ensure that they support the work of the ICB and have a great understanding how they can support improving the health well-being of their constituents.